Really looking forward to it. Thank you, Ruben. Coming up, a telescope for the eye. How implanting a tiny version is helping macular degeneration patients in a huge way. It's coming up next.
In Health Watch this morning, macular degeneration is the leading cause of vision loss.
And while treatment is available for the wet form of macular degeneration, there has not been a way to help the dry version, at least until now.
Doctors at Houston Methodist Hospital are offering a state-of-the-art procedure that's a real eye-opener.
Imagine seeing through these eyes with a dark blob in your central vision. It's hard to see much of anything. It gives you an idea of what it's like to have macular degeneration.
Basically, they don't really have many vision options. So macular degeneration takes out the center of the retina, which is what you use to see, make out faces, read.
You can see why it's so important to find treatment that works. Now, Dr. Rahul Pandit with Houston Methodist Hospital is one of the first to offer a huge advancement through a tiny package.
This is a very neat device. This is an implantable miniature telescope which goes into the eye at the time of cataract surgery in these patients with advanced end-stage macular degeneration.
It doesn't matter if it's wet or dry macular degeneration. Dr. Pandit says he treats both.
I'm just delighted. I think it's the best thing on earth.
Linda Lepp's husband, Edward, is one of the first patients to undergo the procedure. She drove him here to Houston, all the way from their home in Midland in West Texas.
I hope he gets where he can read well and for the rest of his life. I hope that he is happier with his work. He's determined he's going to work, and that's a good thing.
Edward is 80 years young and owns his own store, so reading is an important part of his job.
I could read, but in time the reading was going. And I guess about 6 months ago, the lumber started fading. And being in the parts business, you always have numbers. So you can forget if you don't have the numbers, you're up a creek.
Edward hopes the tiny telescope will help in big ways. He only has it in one eye to magnify images. Patients always use the other eye for peripheral vision.
This is a regular lens right here, and you can see how thin it is, about 1.1 millimeters deep. And this is the implantable telescope. You can see how thick it is. Quite a thick lens. It actually comes from the back of the eye towards the front of the eye.
Dr. Pandit says it's a fairly painless procedure.
You don't feel it? That's a great question, because the iris tissue, which has actually nerves in it, constricts really close to it, but they don't feel it. There's a lot of stitches that go into this. He actually had minimal to no pain, even on day one. Oh, no, you're good.
Though fairly painless, it still takes months to heal and find out complete results. But Edward's vision is quickly getting better after the procedure.
He's moved already up in 1 month from 2800 to seeing about 2160, which is a remarkable improvement. And we assume and we expect that that's going to also demonstrate an improved near vision in the coming months.
A big part of the healing process includes occupational therapy. Edward is learning how to tell his brain to work the telescope.
He has really adjusted well. That's the difference. And he can see, he says he can see TV better, because he had to sit right up on top of the TV. I guess it was maybe 3 feet from it or closer.
Edward says if he does get his eyesight back, he'll never take it for granted again.
I was in high school, I didn't like to read, and college, I didn't like to read. And when I got macular degeneration, the tri-type, I always wanted to read.
Doesn't that figure we always want what we can't do or don't have, and now he's doing a whole lot better, expected to get better all the time. It's incredible. Good to know that insurance does pay for the procedure, but it did take Edward about a year to get it approved, so it was a long process to get there, and now he's still in therapy to try to make it
and this
even
is
better.
Really good for people who are in those advanced stages of it.
Yes.
That's what benefits the most.
You have to have a cataract, and you have to be late stage.
Many people have this experience.
Yeah.
So.
Hope it makes a big difference. It's a big advance, I think.